If you have a herniated disc and want to exercise, most likely you'll have to lie down on the floor to do them. However, throughout the day, the opportunities to lie down and exercise are very limited, and that's why I've thought about you. I'm bringing you 5 essential exercises for a herniated disc that you can do completely standing up, whether at home, at work, or anywhere else, as long as you have a small wall with you. 5 exercises that will cover the most important areas we need to work on. For the first one, we are going to work on lumbar extension. As many of you already know, lumbar straightening, the flattening of that natural curve of the back, which should be like this, is called lumbar straightening. And it's the step before the appearance of discopathies, herniated discs, protrusions, and any type of disc injury. That's why our activity, our effort, has to focus especially on recovering that lumbar extension, even if it's a little painful. And that's the exercise we're going to start with. To do it, as you know, you need a wall, a lot of motivation, and most importantly, consistency. For this, we're going to stand in front of a wall. I want you to place your forearms on the wall as if you were going to do a plank. Notice that both my shoulders and my feet are aligned vertically. My feet are not behind or in front of my shoulders. From this position, focus on your belly button and lower back. I'll adjust this so you can see it properly. And through your belly button, I want you to move your pelvis forward, straight, in line. I look at my fists, I move my pelvis forward gently, hold for a few seconds, and then return to the starting position. I lean forward until I start to feel some tension in my lower back, and then I return to the starting position. If you're able to go very far, even better. If you start just a little and already feel some discomfort, well, then work within that small range of motion, okay? It's not necessary for you to go very far, but rather to work within a range of motion where you feel comfortable. Let's go again. I've done my forward setup. It's also normal for the first repetitions to last more than 3, but as we go on, as we work, as we improve that mobility in extension, I assure you that you'll go farther and farther each time, and it will become more and more enjoyable. Let's do 5 more to reach 10. I lean forward, and as you can see, each time I reach a little farther. 6. I lean forward, careful. I lean forward, careful. Because if you do this at work, 7, people will probably look at you pretty weird. 8. We have 2 more forward. Back, 9, last repetition, I tilt my pelvis, bring it really close to the wall, bringing that belly button as close as possible, and 10. Very good. There are also alternatives in case you don't have a wall. Basically, what we do is place our hands above our iliac crests. The iliac crests are simply those bones that stick out to the sides of your pelvis, right in line with your belly button. We place our hands at the waist level, with the thumbs on each side of the spine, not on top, but resting on each of the muscle bellies we have at the lumbar level. If this is our spine, you can see that this little space here is meant for large muscles. What we do is place our thumbs on both sides to rest on that musculature rather than resting on the lumbar vertebrae. From there, what are we going to do? A movement of retroversion and extension. I place my thumbs, I move my pelvis forward and look up at the ceiling, hold for a couple of seconds and return to the starting position. A very good alternative that will also help you work on that lumbar extension. Again, it might be a little painful at first, but as you do it, I assure you that you'll see how the area loosens up more and how your spine regains that lumbar extension. Make sure to move your head along with it to make the exercise more effective. Before we continue, I want to let you know that I have a very special class for you, purely theoretical, where I teach you about the lies, the treatments that are incorrectly recommended for herniated discs. I'm leaving it for you for free in the upper right corner of the screen, so you can go in, leave your email, and receive it, where I explain to you step by step what the biggest lies are that you've been told about your herniated disc and how you should treat it correctly. Besides these exercises, more than just a few are needed for results. You have to work on that recovery from many pillars, especially consistency. Last repetition, I lean back, look up at the ceiling, and relax. Very good. This has really been the first standing lumbar extension exercise, both with and without the wall. Next, we'll examine a plank exercise with a position very similar to the one we've seen, but with crucial differences. I want you to stand straight, with your forearms resting against the wall again. And from here, I want you to take a big step back, okay? The farther back you step, the harder the exercise will be. I want your spine to be aligned at all times, meaning you should be able to draw a straight line from your shoulders to your feet. Right now, we're not looking for forward movement, nor are we looking for your glutes to be pushed back. Straight position, and from here, I want you to think about your belly button. I want you to pull that belly button in as deep as you can, as far inward as possible, as if you wanted to reduce the space around your waist. And we're going to do it with breathing, so the exercise will be much more effective. I want you in this position. When you achieve it, when you hold it, you might feel a slight pull in your calves. By the way, I want you to take a breath in, and as you exhale, pull your belly in as much as possible. We're going to do 3 breaths. Like this, I breathe in, push my belly button out, then exhale through my mouth as if I were blowing out a candle. I pull in my belly button. 2, 1 more. I breathe in. I exhale through my mouth as deeply as possible. If you're good at it, if you don't have pain or discomfort, you can do it by placing only one arm on the wall, which makes the exercise much more challenging. I inhale, exhale, pull in my belly button. Let's do 3. We have 2 left. I inhale, exhale, pull in my belly button as much as possible, blow out through my mouth. 1 more. We release, and to make 9, I do 3 more with the opposite arm. I inhale, keep that alignment, exhale, and inside abdominal belt contracts as I inhale. And exhale. 2. And exhale. 3. Very good. With this, what we achieve is to activate that deep abdominal belt. We all have abs. We all have a muscular belt that goes from our lower back to just in front, the belly button. And the stronger that belt is, the more protected your lower back and your spine will be. It's essential to know this and obviously to apply it. The next exercise is a hip extension. We're going to look for a small sign to lean on and a small book to step on as well. We have everything we need here. It could be a chair, a piece of furniture, a wall, or really anything you want. Work from a completely safe position to avoid falls. The book is going to help us work on hip extension, one of the movements that also tends to have the most deficits when working and that can contribute to the appearance of a herniated disc. So we're going to do the following. I want you to stand on one leg on that book, focus on your right leg, and place your hand here at your waist. And from here, staying very straight, I want you to move your leg back as far as you can. Notice, the tip of the foot doesn't stay facing forward, but I turn it slightly outward. What this does is contract the gluteus maximus, which is very important for protecting the lower back area. We hold for a couple of seconds and then return to the starting position. Very straight, very upright, I support myself on my chair and go backward. 1, 2, 3. Here's where we should feel it. Good contraction. I take a breath and let's work with breathing. I also exhale. 3. We're going to go up to 10. Leg vertical, not touching the floor. Leg extended. Toe pointing outward, not forward. It's directly outward, not forward. It's outward. He may insist a lot, but it's necessary for you to understand it. Let's go again. Toe outward. Greater glute contraction. 5. Let's go again. 5. 6. It's okay if doing 5 or 3 reps hurts, or if your supporting leg hurts. You get down, walk a little. 7. And then continue doing the remaining 5. 8. Let's go again. Last 2. 9. Last repetition. And 10. We go down, switch legs, move that book a little, and lean on it. I leave my left leg in the air, and from here I move that leg backward. Look closely, slightly outward. It's as if I want to kick the wall. Can you see it from that camera? We hold the position for a few seconds. And we come back. 1. Let's go again. Extension. Let's go again. Extension up to 10, always with total safety. 3. The truth is that working the gluteus maximus gives me really good sensations in my lower back. 4. Let's go again. 5 more. Extending and pointing toes outward. Take this leg back as far as possible. 6. And look, what we have to avoid is this, okay? Don't lean forward. It's ineffective. We want to focus on our left lane. Let's go for it. 7. The last extension. 8. The last 2 extensions. 9. Last repetition, extension, and 10. Wow. Strong sensations in the hip and lower back. Be attentive. We've worked on the extension of the lumbar area. We've worked on that deep abdominal belt. And underneath, we're working the glute, which is essential when it comes to improving that lower back pain. Let's put all this away and grab a small stick. But don't worry, because if you're at work, you can also use a sweatshirt, a towel, or just an imaginary stick. Now we have our imaginary stick. Mine is made of wood. Yours can be made of whatever you want. You can grab a towel, like I said, a sweatshirt, whatever. The deadlift is one of the best exercises to do if you have a discopathy. The thing is, we always associate deadlifts with lifting a lot of weight and going wild, but it doesn't have to be that way. You can do many different levels of deadlifts. It's not about doing it or not doing it or seeing it as black and white, but about finding a gray area, a risk point where you feel comfortable and challenged. I'm going to explain one that I really like. Look closely. I sit against the wall in such a way that my shins are vertical, but my knees are slightly bent. The amount of knee bend determines the exercise's difficulty. Avoid excessive bending. Look, I have about 30 degrees. In fact, I'm going to lean back a little more. From here, I place my back very straight, and I place the cane between my hands. I want you to make the movement as if your back were a metal plate, as if it were a stick too, and that the movement happens only here, at the level of your hips, as if it were a hinge. Pay close attention. I want you to slowly slide that stick. My spine doesn't bend down until it's just behind the knees. I don't do this. The goal isn't to go down. I don't round my back. Instead, I keep a correct position. Shoulder blades back, really close together. I go up to there and then slowly return to the starting position. 1, I go down, 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 just in front of the knees, and I come back and come back and come back and come back and come back. 2, if it's too hard, go down just above the knees. Do we reduce that range of motion or do we position ourselves a little bit? Is it too easy to raise the height for an easier workout? Well, then we go down a little more, lower than the knees, which increases the difficulty. But it's essential that your spine stays straight, that the movement here is like a hinge, and that your shoulder blades are pulled tightly together in the back. If I do it this way, I can go farther, but it's incorrect. Your shoulder blades should be tightly closed and together. Let's do 5 more. Going down in front of the kneecap. Back. 6. Going down, back. 7. Going down. Back 8. We have 2 left. 9. Last repetition. I'm going to go lower for those who want to work with intensity. 10. Good. Let's separate. Sensations where we're going to feel them. The back of the thigh, gluteal area, lower back, and even where we shouldn't feel them, like the front of the knee. Okay, it's essential to keep your back straight, look forward, and work only from the hips. We finish with one of my favorite stretches. We return to the same position as before. I want you to sit on your buttocks, lean against that wall, and keep your knees slightly bent. Next, I want you to bend one knee and place your ankle resting on top of it. Watch your step, as those with poor balance may fall. Always remember to work safely and place a piece of furniture or a chair nearby so you don't fall. I'll place my chair here, so if I fall, it won't be during the video. Here's what I'll do next. Is bring my chest toward my right knee. Pay close attention. My chest moves closer to my right knee, and just like before. I don't want my back to round forward and form a hump, a hunchback, but instead I want to stay upright. My shoulders go back and it's my chest that moves toward the knee. As you can understand, here we also work a lot on balance, so do it safely. Use a chair, a table, whatever you need. It's a very good stretch because we're going to feel that tightness, especially here in the glute area and that deep internal musculature at the hip level. It has a very important impact on your lower back. Let's go back again, okay? I support myself with my knee slightly bent. I position myself with my leg crossed, my ankle resting on my thigh. I lean on my chair so I don't fall, and from here I bring my chest towards my knee. Tightness, very good, interesting exercise. Maintain a neutral back position and avoid rounding or hunching over. Keep your shoulder blades pulled back. Hold there for 20 to 30 seconds as long as your body allows without falling. Very good stretch, one of my favorites. And next, we switch legs. I'm going to move the chair to the other side and we'll continue. I lean against my wall, sitting again. I move my feet forward and I place my leg crossed so that the ankle rests on the opposite thigh. From here, I bring my chest toward my left knee. And I'm going to note tightness exactly here at the level of my left glute and I hold. 20 to 30 seconds. Very good. Very good sensations. Stick your chest out, don't round your back, and work on that hip mobility. 10 more seconds. Very good. Perfect, amazing sensations, amazing work. At the level of the hips and the lumbar area, let's recap. We've done lumbar extension work. Because remember that spine is always in rectification. When a herniated disc is present, not always, but in a large number of people, it does happen. Afterwards, we have worked all that abdominal belt around using the plank. Afterwards, we worked on hip extension, which also has a very important implication at the lumbar area. Then we did the deadlift with the stick, and finally, this hip stretching and mobility exercise. 5 essential exercises that, if you do them several times a day, I assure you they will help you improve your pain. The key takeaway is that I have an extra class where I'll discuss the best alternatives and treatments for your herniated disc. To access it, I have left it for you up there before, so I can't leave it again. It will appear in the description or first comment below. You enter, leave your email, and you'll receive it in your inbox so you never forget it and never lose it. Obviously, the only thing I ask is that you do the exercises, stay consistent, and share all of this with people who need it. I'm sure there's someone in your office, at your home, or in your family who has some kind of discopathy or some kind of lower back pain, and I assure you that these exercises can make a real difference in their life. That's all. I thank you from the bottom of my heart for making it to the end of the video, and I hope to see you again very soon in one of my other videos. Right, friends?